All right, welcome to another episode of the Love, Hope, Lyme podcast. My name is Fred Diamond. I'm the author of Love, Hope, Lyme, what family members, partners, and friends who love a chronic Lyme survivor need to know. And of course, I'm the host and the producer of this podcast. Thanks for being a listener of the Love, Hope, Lyme podcast. You can find my book on Amazon. Dr. Karlfeldt, I've made the e-version of my book free for chronic Lyme survivors. We've given out close to 1,000. So if you want to get a copy of the PDF of Love, Hope, Lyme, it's free for chronic Lyme survivors. Reach out to me via Facebook or LinkedIn, or you could just reach out to me via freddiamond.com. Click on the Love, Hope, Lyme button, and I will send it to you. Now, when I wrote the book, I met some amazing leaders in the Lyme community, doctors like Dr. Michael Karlfeldt, who we're going to be talking to in a second, other medical practitioners, charity directors, and they've all helped me to understand what living with Lyme is all about. So on this podcast, I've invited them to share their insights into how you can support those you love. And again, if you're a chronic Lyme survivor, Dr. Karlfeldt, we've had a lot of chronic Lyme survivors who listen to the show and they reach out to me. The goal of you being here is to help you understand how you can let your family and friends support you, how you need to be supported. Again, we transcribe every episode we've ever done. You could find all of the back episodes, of course, on Apple, wherever you get your podcasts, or on freddiamond.com. And once again, click on the Love, Hope, Lyme button. All right, so I'm really excited to talk to Dr. Michael Karlfeldt today of the Karlfeldt Center in Boise, Idaho. He's the podcast host for two podcasts, The Integrative Cancer Solutions with Dr. Karlfeldt, where he features cancer survivors sharing how they beat cancer. And also, this is how I discovered him, The Integrative Lyme Solutions with Dr. Michael Karlfeldt, where he features people who have successfully conquered Lyme disease. And Dr. Karlfeldt, when I first realized that I wanted to know more about what someone I loved was going through, I went up on Facebook and I discovered your co-host for the Integrative Lyme Solutions, Tanya Hoibel, and she actually was on my sales podcast. You know, I'm the only person on the planet who has brought Lyme disease awareness and sales performance improvement together. But we did a show on people who have overcome Lyme disease and have devoted their life to the mission of helping others. And Tanya was a great example. We also had her partner, Lyme Conquerors, JP David, and also someone who's been on my podcast, Greg Kirk, the author of the Gratitude Curve. So I've been following you, and I just want to acknowledge all the amazing work that you've done. So give us a little bit of a deeper introduction, and then we're going to get some of your insights on what family members, partners, and friends need to know.
Well, it's such an honor to be on your show. Thank you so much for inviting me and for what you're doing for the Lyme community. That is fantastic. I'm a naturopathic doctor. I've been in clinical practice since 1987. I've been that's several 100,000 patient interaction. Lyme, the reason I'm so passionate about Lyme and cancer, I actually put them in very similar categories because they are so devastating to people. They are, it hits people in, it's such a chronic, I mean, both of them are chronic diseases. Once you have Lyme, you always have Lyme. Once you have cancer, you always cancer. And it is something that the medical profession have not solved. And I think we need to reach out, and that's why I do podcasts, because I love then speaking to people that have found solutions and then be able to communicate about those solutions for others that are struggling, because it is such a devastating disease and it's so misunderstood. And I love how you're kind of bringing the angle, the importance. I mean, you have the Lyme sufferer, the one going through Lyme, but then you have the environment, the people around that individual, and how should they behave and how should they interact, and that's a big issue.
Yeah, it's when I decided to learn more about how someone in my life was struggling with chronic Lyme disease, I thought I knew everything. And as I say in the book, I used to say my mission was to keep this particular person out of stress and understand where the best gluten-free pizza was. And then when I just dove in the summer of 2021, I realized, Dr. Karlfeldt, I knew 5% of what I should know. And I just dove in and just to learn this. And it's such an unbelievable disease. Like you just said, when you have chronic Lyme disease, you always have chronic Lyme disease. You're always going to have the bacteria in your body some places. And it's really, it blew me away have this disease. But the other thing I read was 75% of relationships with someone with chronic illness terminated. And usually it was the spouse who said, you're not who I married, or you're not who I began the relationship with. You know, you don't work anymore. You can't get out of bed. This ain't what I bought into, which is why I wrote the book, to help get some empathy, some cases sympathy out there. Let's get started. So you've been studying this for a long time. What are 3 things family members, partners, and friends need to know about what their loved one is going through?
Well, and first to start with, Lyme is never the same from one person to the other. I mean, you're looking at a mixture of different pathogens that can express in different ways. So you never know what you're going to get. And so, what may be taking place one day may be different the other day. And so you have to continually kind of meter and monitor to see what's going on and what that individual is going through. One day it can be panic attack, anxiety, depression. Another day it can be extreme body pain, gut issues, and then extreme fatigue, or a combination. Or maybe you have people that are not able to, they live in the same town for 35 years, and now they're stuck at the gas station. They don't know how to get home, and so you have obviously that patience and that understanding, and not make the individual feel like, well, why can't you just do this, or why, so you have to. You have to just kind of allow the individual the space that they need in order to be able to, in their mind, heal. And so that becomes really important. The second is to communicate to the individual that, yes, I understand that I don't know what you're going through. I mean, to kind of use language, saying that, I know what you're dealing with. I understand, or you will never fully understand, and it's okay to not fully understand. It is good then to continually try to learn as to what's going on. And I would suggest, exactly like what you're doing, go on, listen to podcasts. I mean, we had people listening to our podcast that we do, and they say, now I finally understand. Whether they do or not, but at least they gain some insight as to what my spouse is dealing with. So now I have more compassion, I have more patience, I have more understanding, and then to create an environment that the Lyme sufferer can be functional in. So it is, there's certain, obviously the Lyme then robs the individual from a lot of things that they used to be able to do. So to find joy in life is going to be much more challenging. So you want to then try to enhance the things that they can do, and support them in experiencing life in the way that they are able to, because that joy in itself, and that hope and that connection is what boosts the immune system and gives them a reason to continue fighting. Because a lot of Lyme sufferers, they give up. I mean, because it is hard. It is so encompassing of a disease. So they just kind of throw in the towel, and they get on pain medications, they go on anti-anxiety medication, antidepressant medication, and they just try to kind of numb themselves and fade away. So I would say that would be the second thing. The third thing is probably, so you have Lyme patients, and there's only so much that they're able to do, and some days they need their privacy, and there may be some Lyme sufferers, they may not even remember your name, and that we've kind of talked to some patients, some people that have gone through that. So you need to then just be support them in their healing journey. And when they need rest, you kind of allow them to have the rest. In regards to the diet, because that becomes a really huge component. to be there supporting them in their dietary habits. And I would probably, shift the family, if it's possible, into those dietary habits. And that tends to be, reducing anti-inflammatory foods, like gluten, dairy, corn, sugar, and more kind of a plant, good quality plant-based, tends to be really good. And so being supportive in that, and then also being engaged in their healing journey to, engaging and trying to find doctors, trying to find nutritionists, and trying to learn more about the different therapies, the treatment that they're doing, and kind of be engaged in that healing process. I would say that those would be three important components that we all, which it's a lot of work. It's a huge amount of work. So, and I get it. I mean, some people say that, I don't want to be in part of this. I mean, yes, you love an individual, but you say, this is just way too much. And for some people it is, but if you really love this individual, you want to be there, you want to support them, and you want to be engaged in what they're dealing with, and be part of that solution, because there is a solution. People have done it. People have been suffering for 30 years, and they have found a solution. So, be part of that, and you can then reclaim the individual that you love so much.
So what shouldn't they be doing? You've probably seen hundreds of thousands of couples, I guess, who have come in, and everyone, brings in. First of all, when you get a Lyme patient who, you're enabled to treat, do you emphasize, or do you look and see what kind of support they may have? Is that something that you're concerned with, or not? And then what are some things that you've seen that the support system shouldn't be doing with the Lyme survivor that they love?
Yeah, so the most people have, they have some kind of support, but it's very challenging. It's actually very rare for the support system to be fully engaged and fully understanding. A lot of people, and it's the same I see with cancer as well, and that's, I draw a lot of parallels between the two, is that you see the initial issue, you see the pain, the suffering, and you want to be there fully, and you have a certain moment of attention, and then all of a sudden, it's not fixed in a month, or it's not fixed in 2 months. Now we're down 5 years and it's still the same. So it is the patience, and recognizing that this is something you have to do for the long haul. Lyme is not fixed in just a short period of time. So that is not very common. So for individuals that can recognize that and become that support, that's huge. What Lyme patients, what they can do, I think it is, obviously they are very limited in their ability to communicate, their pain, and they are not really in a place where they can set up their environment, for their own success. That takes a lot of energy. So if they have the ability to rely then on their spouses, or their environment to help in that, to create that environment, that becomes huge. The different tools, for then as an outsider, that are really helpful. Diet, number one, is huge. Stress, eliminate stressors is huge. Looking at emotional traumas, that is fantastic. That's really, really important. And then finding a place of gratitude, seems to, it's been fascinating. It's been a number of people we've had on our podcast that where they use gratitude, and just gratitude alone became kind of the healer for the individual. They were saying, I'm thankful for being able to take this step. I'm thankful for being able to brush my teeth, things that we take for granted, but then to create that in that environment and that energy that is positive for the Lyme sufferer, where you can promote gratitude and you can promote joy. I think that becomes, one of the most important things.
Yeah, no, that's a great point. And one thing that I've seen a lot in the Lyme community is the support of each other. You know, constantly you see people expressing gratitude for each other. You see people who have acknowledged that people have become great friends. As a matter of fact, you're, like I mentioned, your podcast partner Tanya. When I first discovered what she was doing with the Lyme Conquerors website, a Facebook group, and then I discovered, you know, she was doing the show with you. You know, she and I have become friendly, and so many people say they depend upon the Lyme community because a lot of people don't understand. I want to ask you a different question here. You devoted your career to Lyme and cancer. One thing that I've heard a lot of, Dr. Karlfeldt, is that doctors don't understand, or they don't get it, or those types of things. And I have a lot of family members who are doctors, and I love them, and they're amazing. But I see people who've gone through Lyme who've struggled with the medical profession. Can you give us a little bit of insight in why that is, and why there may be a distrust of the medical profession?
Well, and they're right, and even someone like myself, and that's why it's so important for me to have Tanya on the show, because it's somebody that hasn't lived it. It's impossible for them to fully understand it. I mean, I can see from the outside, and I can understand patterns and what to do with those patterns, from what I've learned from other patients. But I will never fully understand what a patient is going through. So that is me having seen hundreds and hundreds of Lyme patients. Then we're looking then at a medical doctor where Lyme is really not recognized. It's really not a disease. I mean, it is something you give antibiotic, short term, and it should be gone. And if it isn't gone, it isn't Lyme. So it's a lot of medical doctors say, and I hear this on the show many times, I gave you doxycycline for 2 weeks, so Lyme is not the issue anymore, because we treated it. Lyme is treated, because so we get done with it. So for a Lyme sufferer, to be going from, and many Lyme sufferers, they have 30 different doctors, and they have 30 plus different diagnoses, and so it's hard then to trust the medical field when they again and again don't get to the core of the issue, and they actually really don't care. And it always ends up with, well, it's got to be in your head. You're a drug seeker, you're a medical doctor seeker, and so it's just got to be in your head. So how can a Lyme patient be trusting that doctor that tells them that they are crazy? That's not how trust is established. So they're right. I mean, they really shouldn't, and so they should mistrust until proven different.
Yeah, it's a very complicated disease on so many different levels, not just on the medical side, but of course, you mentioned that doctors will say, well, if you didn't survive after the 2 weeks of doxy, you still have pains, and it wasn't Lyme disease. Well, the book was written, my book, Love, Hope, Lyme, was written for the chronic Lyme survivor, the one who was bitten 10, 12, 15, 20, 30 years ago, wasn't diagnosed for 10, 20 years, finally was. And then, of course, at that point, it's a struggle to cure. We're talking with Dr. Michael Karlfeldt. Hopefully, if you're listening to this right now, you are committed to someone, a family member, a partner, or a friend who you've discovered has chronic Lyme disease, and you love them and you want to be of better support. Dr. Karlfeldt, give a little bit of some insights into what their journey, what the loved one, the Lyme survivor, what their journey will look like, so that the family, friends, and partners who are listening today can understand that, like you just said, it's not going to be done in 2 weeks. It's not okay. And that's how I viewed it before I really dug in. It's like, okay, well, let's figure this out. Boom, boom, boom. Okay, what do you want to do in 2 weeks? What do you want for dinner? Doesn't happen that way. We've all learned. Give us some insights for the people listening on what the journey will continue to look like.
Well, one thing that's important to understand. I mean, you feel, let's say Christmas events, events. You think, well, should we just plan one? We've always planned it at home. All the kids and every friends, they come. And why can't we have it now? And why is it too much? It's going to be too much. Don't have events, and recognize that you may be the one that takes, I mean, you almost have to look like you are single and a caretaker at the same time, because the individual with Lyme may be not functional for 2 months. And then they have, a few, maybe they have 2 months that they're doing great. So then you think, well, great, they're over it, life back to normal, we're done. And then all of a sudden they crash again. And so that is the normal. So you have to expect the unexpectedly. You can't really, just because they've done well for a period of time, they're always well. It's not a kind of a straight line trajectory. It is it goes up and down and in and out and around and round, and you have no idea kind of what it's going to look like tomorrow. And so you need to be prepared for all the possible contingencies. And you need to then kind of set it up in a way so that if the kids need to go to school, somebody needs to drive them. If your wife is the one dealing with Lyme and she usually is the one driving them, then you need to prepare for that. Either you have to, or you have to have backup. In regards to food, you got to be probably being the one preparing for food, and you're probably gonna not being able to have that emotional connection that you wanted and that you had when you fell in love with this individual. That person may not have that energy. They may not really like you a lot. I mean, they may be angry, and it's a lot of times it's not because they're angry at you. It's because they're struggling within, they're frustrated with their own limitations, they are in pain. And so you are the one closest by, so they are going to project that onto you. And so you need to recognize that this is nothing personal. When they're yelling at you or when they don't want to talk to you, it's nothing to do with you. It has to do everything with what's going on inside of them. And so you need to not let that stick onto you, and just kind of be there and loving, and then just kind of supporting the individual in whichever way that you can, and don't let that sink in. So it is hard. It's a hard journey, and it's not for the faint of heart. It is important to and like you were doing, go into the Lyme community, Lyme groups, and then reach out to other people. And I actually think that there should be a group. I'm not sure if that exists, but it should be, a spouse of Lyme sufferer Facebook group. And I'm not sure if that exists or not, but there should be, because I think that would be a fantastic support group.
Yeah. So Dr. Karlfeldt, just to put that in a little perspective, in summer of 2021, when I realized I needed to know more about Lyme disease, I jumped up on Google and I typed in Lyme disease spouse. And, whenever you type in anything in Google, 10 million pages come up. You type in Boise, Idaho, where you are, 10 million pages come up. 2 pages came up. And it was an article from 2014. And it talked, I think it was written by either a Lyme survivor. I think it was written by a Lyme survivor who talked about her guilt, the guilt that I wasn't a better mother, I wasn't a better spouse. And it was like one article, 2014. This is the summer of 2021, which is why I wrote my book, Love, Hope, Lyme, what family members, partners, and friends who love a chronic Lyme survivor need to know. Dr. Karlfeldt, I want to just acknowledge you for the great work that you've done to help, thousands of people. I really didn't know about your cancer background, treating cancer patients as well. Obviously, I knew about the Lyme because, I've listened to your show a bunch of times. I've referred some people to it. Some of my friends have been on your show. Like I mentioned, Tanya has been a good friend. So I just want to acknowledge you for the work that you're doing to support this community. It's a challenged community. The reason I did this podcast and the reason I wrote the book was to try to bring some peace, as I like to say, to a challenged community. So kudos to you for the tremendous work that you've done to help so many people get through just an absolutely ridiculous and challenging disease. Any final thoughts? Give us one final insight or something, or a final tip you'd like to recommend before we shut down today's show.
Yeah, learn how to meditate. You have to, and that for spouses, you have to allow yourself to have time off. Yeah, and so it is a whirlwind, and if you're gonna do this for the long haul, you need to figure out a way that you can relax, you can recover, recoup, and so that you have some joy in your life as well. And so it's finding that balance. And I think that it's not an either or, where you completely distance yourself, I can't deal with this, or, I'm doing this, 100% of the time. You set yourself up for success. And with that, you're engaged in the healing process, and you understand, what the individual is going through. But at the same time, you need to find joy in your life. And it will actually help the Lyme sufferer as well when they see that you are doing things for yourself, and that they are not the cause of, you lose, missing out on life, so it will help them and make them be more at peace, when they see that.
All right, once again, I want to thank Dr. Michael Karlfeldt for the great insights today. My name is Fred Diamond, and this is the Love, Hope, Lyme podcast.